This video contains information about the use of Gonal-F Multidose. This drug has been prescribed to you by your doctor for treating infertility. To help you prepare and use this medicine, watch this video and read the instructions provided carefully. Ask your doctor, nurse, or pharmacist to explain anything you do not understand. Keep the leaflet. You may want to read it again. Preparing and self-administering Gonal-F Multidose. Make sure you have all the necessary materials assembled in a clean area: Gonal-F Multidose powder vial, pre-filled syringe labeled bacteriostatic water for injection, Gonal-F custom dosing syringe graduated in IU, alcohol swabs, sterile gauze pads, and lastly, a sharps container. Wash your hands with soap and water and make sure you are working on a clean, flat surface. Step 1. Mix. Using your thumb, flip the protective plastic cap off the Gonal-F Multidose vial. Wipe the top of the vial with an alcohol swab. Carefully twist the needle cap off the syringe labeled bacteriostatic water for injection USP. Do not touch the needle or allow the needle to touch any surface. With the vial of Gonal-F powder on a flat surface, insert the needle of the pre-filled syringe straight down through the marked center circle of the rubber stopper. Slowly inject the water into the vial by pushing down on the plunger. After all the water has been injected into the vial, remove your finger from the plunger, allowing the plunger to rise to its original position. Withdraw the needle safely. Dispose of the syringe in the sharps container. Do not use this needle and syringe to inject your dose. It is important to note that you should not use Gonal-F if it contains any particles. Report this to your doctor, nurse, or pharmacist immediately. Step 2. Preparing your injection. Wipe the top of the vial with an alcohol swab. Remove the wrapper from the custom dosing syringe. Carefully loosen and pull the plastic cap from the needle. With the vial of reconstituted Gonal-F on a flat surface, insert the needle through the marked center circle of the rubber stopper. Without removing the needle from the vial, turn it upside down so that the needle points upward. With the needle tip in the liquid, slowly pull back on the plunger until the syringe fills slightly more than the unit marking that corresponds to your prescribed dose. Keeping the needle in the vial, slowly push the plunger back to your prescribed dose. This will clear away any air bubbles. After checking that you have the plunger set at your prescribed dose, carefully remove the syringe from the vial and recap the needle. The custom dosing syringe is now ready for administration. Step 3. Injecting your dose. Your doctor, nurse, or pharmacist should provide you with injection training. Inject the prescribed dose as directed. Usual injection sites include the skin on the stomach, upper arm, or upper leg. Change the injection location each day to minimize discomfort. Choose your area and clean the recommended injection site with an alcohol swab and allow it to air dry. Uncap the injection syringe. Hold the syringe with one hand the way you would hold a pencil. With the other hand, pinch the skin around the injection site. Insert the entire length of the needle completely into the skin at a 90-degree angle. Once the needle is inserted, you may release the pinched skin and depress the plunger in a slow, steady motion until all the medication is injected. Gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Step 4. Disposal. Discard all syringes and needles in your sharps container. Do not throw away empty syringes or loose needles in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of heavy-duty plastic, fitted with a tight, puncture-resistant lid, leak-resistant, upright and stable during use, and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, follow community guidelines for disposal. For more information, go to www.fda.gov/safesharpsdisposal. Step 5. Storage. The Gonal-F liquid solution may be stored refrigerated or at room temperature between 36 and 77 degrees Fahrenheit for a maximum of 28 days from when the powder is mixed with water. Do not freeze. Discard unused liquid solution after 28 days. The injection syringes provided with Gonal-F Multidose are designed for use only with this product. Do not use the injection syringes to administer other drugs or hormones. All unused syringes should be discarded. Your doctor, nurse, or pharmacist should show you how to set the prescribed dose and use the syringe. For more information and the full prescribing information, please visit www.fertilitylifelines.com or call 1-800-LETS-TRY. Important information about the proper use and risks of Gonal-F, Pholotropin alpha for injection. What are the uses of Gonal-F? Gonal-F contains Pholotropin alpha, which is similar to the human hormone follicle-stimulating hormone, referred to as FSH. FSH belongs to a group of human reproductive hormones. It is used in certain infertile women to help in the production and release of a mature egg and pregnancy. Gonal-F will not help women whose ovaries no longer work because of a condition called primary ovarian failure. Gonal-F may also be used in women who are in an assisted reproductive technology (ART) program, such as in vitro fertilization, to help their ovaries make more eggs. Gonal-F can also be prescribed to increase sperm production in men with a rare condition that affects sperm production. Who should not use Gonal-F? You should not use Gonal-F if you are or think you might be pregnant, have primary ovarian failure, ovaries no longer producing eggs, or have an allergy to recombinant human FSH products or any other ingredients in the medication. Do not use Gonal-F if you have cancer of the sex organs or brain, or uncontrolled thyroid or adrenal disease, women with a history of abnormal bleeding from the uterus or vagina, or with swollen, enlarged, or painful ovaries should speak to their doctor before starting treatment. What are the possible side effects of Gonal-F? The lowest dose expected to achieve the desired results should be used. Your doctor will monitor your response to avoid overdose, which can lead to serious side effects, including blood clots. You should contact your doctor if severe pain or bloating in the stomach or pelvic area, severe upset stomach, vomiting, or weight gain are experienced during treatment. These could be signs of a rare but serious condition known as ovarian hyperstimulation syndrome, or OHSS, which can result in hospitalization. Use of Gonal-F by a woman can be associated with fertilization of more than one egg. This can lead to complications for the woman and the birth of 2 or more babies. The most common side effects reported by women were headache, ovarian cysts, upset stomach, and sinus infection. The most common side effects reported by men taking Gonal-F were skin pimples, breast pain and growth, and tiredness. In both, injections may cause some discomfort.